3Shape scanning system. We've been using it for a few years now. It has completely changed the way that I certainly do my dentistry. It's certainly the most exciting thing to have happened in the last 10 years in dentistry. The scanning device is clean, it's quick, it's very easy to use. The whole patient experience is so much better.
I like that it's very accurate. I like that you've got some additional features so you can see how much reduction you've got on the heat map thing. So it shows you how much, where you're tight on space, if you need to go back and adjust it a little bit more. So it sort of leads to minimal adjustments when you come to fitting the final crown.
I found it quite difficult to start with, just because I wasn't used to using both hands at the same time and pulling the soft tissues out, well, not pulling the soft tissues, but moving the soft tissues out of the way. Having the different angles definitely played with my mind, but once you get the hang of it, it's so much easier than the impressions. It's easier for the dentist, it's easier for the nurse, and it's nice for the nurse to be involved in the scanning as well.
Incredibly easy to use, actually. The learning curve was steep within the first 2 hours, and then the rest is just intuitive.
For my patients that don't like things in their mouth, like they like to gag perhaps, or a bit claustrophobic, sliding a little camera around in their mouth is so much easier. So it's a win-win situation, yeah, for both of us. We had a lovely chap that came in and he basically just handed it to us and we just basically got our hands on it and played with it. And it's very intuitive. There was no sort of learning curve, you just went in and played with it. And the more you use it, the more you figure it out. Oh, it's incredible. The number of people that have asked for straightening their teeth, whitening, changing over some silver fillings to white fillings. It's phenomenal. It sells itself, basically.
I think it's quite helpful for patients' sake as well, because it just means that when the patients kind of leave at the end of the day, if it's kind of a really complicated case, we pretty much have the patient's mouth here with us even when the patient leaves. It means we pretty much have their mouth when we want it straight away, so we don't need to call the patient in. We can see exactly what's in the mouth. So it is really helpful being able to kind of do that without having to drag them all the way here.
Yes, definitely. So with wet impressions, I'm often having to do some adjustments here and there, and the fit appointments often take me a lot longer than they should. But so far, the results of the digital scanning, it's just, I know I can book 20 minutes for that fit. I know it's going to fit really well, and it just takes so much stress out of it.
As soon as the orthodontist gives in to stop being so old school with the impressions, but yeah, we certainly do want to be using it, like I said, just for time, saving time, and for the patient's comfort as well.
Patients love it because it is technology. People think that's fantastic. They can turn around, look at the side of you and see what you've been doing, and actually look at their teeth and go, seriously, is that the colour of my teeth? And you're like, yeah, that's the colour of your teeth.
We have the Trios scanner, which has the support structure of Straumann behind it, and knowing Straumann through all our implant work and knowing that they are just fast moving through all the digital world, we couldn't have picked a better scanner and company to be working with.